Welcome to CEO Money. I'm Michael Yorba. Thanks for joining with me today. All right, I have Aitan Zacharin, CEO of the Greater Cannabis Company, with us today. It's a publicly traded company. Aitan, welcome to the show. Thank you for being here.
Thanks, Michael. Thanks for having me.
All right, give us some background on yourself and the company for our viewing audience so we can get to know you a little bit better. And then I got some really interesting questions for you about your delivery system, the marketplace, and things of that nature. But first, let's start with you.
Sure. So I've been involved in public companies in the biotech, consumer product space, and other companies over the past, I'd say, about 10 years. I guess most notably, I ran a company called Fuse Science. Our claim to fame was that we had a lot of celebrity endorsement partners, most notably Tiger Woods as the face of the product. And that business was also focused on delivery technologies. So my experience is really taking companies that have some unique elements to them, whether it's a strong management team, an innovative delivery system, any sort of technology that sets it apart, and bringing it to the masses. So everything from startups all the way through mid-stage companies, but really taking something that's very relevant for consumers and bringing it to market and helping the company along through that process through capitalization and commercialization.
You're in a really hot sector. There's money flying everywhere. Sometimes it's the Wild West, and now it's turning into more of a guided corporate process by taking them public, and you're one of the few that has. Aitan, give me and our viewing audience the high-level view of what the Great Cannabis Company does, not only as a business, but also how it helps humanity, because I've done a little reading on you, and you're definitely doing that.
Great. Okay. I'm happy to speak about it. So what we do is our company, Greater Cannabis Company, is focused on generating unique delivery systems, particularly for the cannabis space. And if you look kind of high level at what's going on in the industry right now, you have basically an industry that has, evolved and developed in a very dynamic way. One that hasn't really caught up, on some of the ramp up with a lot of the technology side. And so a lot of consumers today that are involved in cannabis have really defaulted to what delivery systems are available, most notably smoking, vaping, but haven't really been focused on ones that can deliver in a very specific and standardized dose. And so the issue with that is the dosing for cannabis consumers really varies from delivery to delivery system, and even more so just based on the consumer themselves, right? What sort of strains that they're getting from the dispensaries, etc. And so what we focused on doing is utilizing some of our proprietary technology, which has been commercialized already in the pharmaceutical space over the course of many years, and bringing it to the cannabis industry. And so our flagship product is built on what's called an eluting patch platform, which is basically an orally dissolving thin film. It's very hard to see, but this is essentially our product. It's extremely thin, very flexible. And so what we do essentially is we take cannabinoids. Right now we have CBD, but we work with other cannabinoids, and we load them onto these orally dissolving thin films, not unlike what you'd see with the Listerine strips you put in your mouth and you get fresh breath. But what is unique about this is that this thin film is a multi-layer thin film. You can't tell to the naked eye. It looks like a very single layer thin film, but it's a multi-layer thin film, and it will actually go inside the cheek here, and it will adhere to what's called the buccal mucosa, and that will allow consumers that are using this to basically get all the active ingredients in this thin film, in this case cannabinoids, into their body, into the bloodstream, very quickly and very effectively. And so the way that we do that is this area of the body, the buccal mucosa, has a very vascular mucosal layer, very superficial capillary bed. And so whatever cannabinoids that you load onto this will actually dissolve through that capillary bed and go into the bloodstream and to a very high degree bypass the GI tract and the first pass of the liver where most of the metabolism takes place. And so essentially that gives us the ability to offer the consumer a way to deliver cannabinoids into their body in a very dose-specific way, in a very non-side effect way, meaning a very a way that's very healthy to the consumer without having to worry about the deleterious effects of smoking or vaping or others, and to do it with a very high bioavailability, most importantly. A lot of the other methods of delivery, such as ingestion, for example, only yield a 4 to 11% bioavailability, whereas our technology gets upwards of 50% into the body.
Are there any other applications that you're working with this technology?
Yes, there are other applications to this technology. Our primary focus right now is with cannabinoids. We feel that this is, the space is certainly ripe for disruption, and this type of technology is very much needed. But this technology has been commercialized in the past with big pharma and other applications such as flu products, a product called Theraflu with a company called Novartis. In addition to that, there's been a slew of other products that have been commercialized over the years. One other particular vertical we're focused on now is, well, not us directly, but a sister company of ours is focused on insulin delivery with this similar platform, and that is patented as well. So our very straight focus is going to be on cannabinoid delivery using our technology.
Is there anybody else in the field that you need to compete with in order to gain market share and take the leading edge on this industry sector that you're involved in?
So I would answer in the following way. Our focus is on primarily partnering with cannabis players in the space, anyone ranging from LPs to CPG companies that are already operational, that have a channel distribution channel and have a pretty large footprint. We're not exactly looking to go out there and obtain licenses, in multi-state licenses and basically bring our product to market. We're looking to commercialize it in partnership with companies that are already operational. So in that sense, our competitors are not really the big cannabis companies out there that are operating. However, there are some companies out there that are focused on unique delivery systems such as ours. In my experience in researching them, they haven't really taken a similar approach to ours. Ours has been more of utilizing our platform that had a pharmaceutical application and bringing it to the cannabis space, whereas some of their products are more focused on actually starting from scratch and developing a product around the cannabis market. So ours has been tried and tested. Other points of differences are we've already studied it extensively, and we've received NIH grants, 3 NIH grants that have allowed us to do that. And we've had some very positive clinical results from our platform. So I think we are ahead in terms of the competitive landscape, but certainly we welcome other delivery technologies into the space, which I think would help with consumer behavior and helping bring this to market.
Give me an idea what you think 2019 is going to look like for your goals, your aspirations, your milestones.
Sure, that's a good question. So, right now there's a lot of room, as I mentioned before, for disruption in the space. Just to take Canada, for example, you have LPs that are operating there, and pretty much the market is limited to tinctures and flower. But come October 2019, there's going to be a wider opportunity in the market. And so people, meaning consumers and also companies, are going to be looking for the next innovation, to bring to the cannabis space. And so we think we're very well positioned to be able to capitalize on that. We've already engaged with some companies in discussions and some LOIs. So we have a very rich pipeline of companies that we are hoping to work with in partnership. And as that continues to evolve, I think we're going to see a very bright future for Greater Cannabis, GCannRx, in the market. In terms of projections, we don't have numbers that I would be comfortable throwing out right now, but suffice to say, based on the scale of some of the deals that we have very low in the pipeline and some that have been inked in LOIs, I think it would be, it would be very, very optimistic, I think, to say, and realistic as well, to say that the company is in a very good position, to be able to achieve its goals for 2019.
Now, before we part ways, give us the symbol on the stock.
Sure. The stock symbol is GCAN, GCAN, and we trade on the OTCQB.
And I assume your aspirations are go to NASDAQ and so on, right?
Yeah, that's correct. So when we first went public, which was August 2018, we did a reverse merger and came into our deal with the intention of really building a company. And as I've done before with biotechnology companies in the public space, we think it's a very good place for us to be in terms of being able to capitalize in the market, to be able to effectively execute on our business plan. And absolutely, our intention is not to stay on the OTC markets, but to uplist gradually as the company grows into itself and into its into executing on its business plan, to be able to uplist to a higher exchange.
Got it. All right, Aitan, thanks for being a guest on our show. I appreciate your time here today.
Absolutely. Thank you, Michael.
You're welcome. You've been watching CEO Money with Michael Yorba. Thanks for joining with us. Don't forget, like us on Facebook, follow us on Twitter, subscribe to our YouTube channel.